way to practice anything that relates to ketamine. So let's talk about ethical principles. This will be a brief review for us because most of us have been exposed to this. We do know and accept that conflict is inevitable. It is. Ethical principles, however, do provide the framework and the tools which facilitate individuals and societies to resolve conflict in a fair, just, and moral manner. And needless to say, the better prepared we are, of course, the less likelihood of ethical conflicts occurring. So there are 6 ethical principles for us to consider, and let me lay them out for you, and then we will discuss them briefly because these really do apply to us as ketamine practitioners. The first one is autonomy and freedom. Veracity is the second one. Privacy, confidentiality, followed by beneficence, followed by fidelity, and followed by justice. What are we talking about here? And do these 6 ethical principles apply to you? You might be in California, you might be in Texas, you might be a therapist, you might be a prescriber, you might be whatever the case might be, you might be an MD, you might be a nurse practitioner, you might be a naturopath, you might be whatever. Do these principles apply? And the upshot is they apply to all of us. So the first is remembering ethical principle number 1, which is autonomy. It is the right to participate and decide on a course of action without undue influence. And this applies to both our patients and to us. If we're not comfortable with a certain procedure, certain intervention, we have the right to autonomy. But patients really have the true right for self-determination, which is the freedom to act independently. Individual actions are directed towards goals that are exclusive their own. Now, in terms of veracity, this is something that applies to us, of course to patients, but primarily to us, the practitioners. There is a true duty to tell the truth. Now, what is the truth? And the truth is a combination of 3 things, I think. What the literature says, so the science tells us. Number 2 would be guidelines and principles. And the third would be our clinical experience. And in the world of ketamine therapies, there is some concern that veracity is being sacrificed, particularly by some commercial entities. And it is important that we healthcare providers be aware that over-advertising, inappropriate advertising, over-promising, this is the fix for everything, that kind of stuff, it kind of violates the principle of veracity that applies to the ethical principles all healthcare providers must follow. Regarding privacy and confidentiality, I think by now we are extremely familiar with the concept of patient privacy. This must be protected information in every circumstance. But, in non-ordinary states of consciousness, there might be even more things that come up. As a result, privacy and confidentiality, the respecting of the self of others is crucially important. And needless to say, the principle of beneficence, is this good for the patient? Is this in the patient's best interests? Or am I just doing it because I think it's the right thing for the patient? But maybe what I'm thinking about is my experience or my expertise, or I'm thinking about just doing a procedure without putting the patient's best interests at heart. That would not be acceptable. The principle of beneficence is crucial because there is an obligation on the clinician to do good and to avoid harm. And that balance between those two is something that not only professional bodies will look at should a complaint be filed against us, but the legal system is also very interested in assessing, did the clinician think about the beneficence of the patient? The principle counsels as a provider to relate to clients in a way that will always be in the best interest of one person, one party only, and that is the client. Fidelity. Fidelity to what? It's a beautiful word, isn't it? Strict observation of the promises and duties that we have, what we have agreed to with the patient. Are we executing it? And this principle, as well as other principles, should be honored by both parties, provider and client, but the primary responsibility genuinely falls on the shoulders of the clinician. And that is an agreement we make with our patients. And then finally, we should talk about justice, the principle that deals with fairness, equity, and equality, and provides for an individual to claim that to which they are entitled. So what is a clinician entitled to? What is a patient entitled to? What they're entitled to is what has been agreed to by the clinician and the patient. What they are entitled to is the full-on attention and respect from the clinician, and the principle of justice genuinely is one of the foundational principles of the ethical principles that should guide every clinician no matter what we do. But if anything, it may apply even more so to that clinician who wants to practice with ketamine. But why must we employ ethical principles beyond the simple obvious? Number one is because we respect the individual. In our healthcare system, patients are the whole reason for our existence. That's actually not true in every country, but in ours it most certainly is. We do have a pluralistic society, but individuals can often misunderstand each other. So having this guiding principle that this is really about your needs, dear patient, really is helpful in lots of contexts. And while there may be disagreement, there's no disagreement about that particular issue. And how do we go about creating an understanding and agreement with the patient and with the system under which we work? So first of all, we have to create a set of rules that we might call common ground rules. This is most often done with informed consent. And informed consent should, of course, be written, but often there are elements of informed consent that simply cannot be written. They are, however, discussed. But that discussion must be documented. It's really important that documentation in the work we do with ketamine be appreciated as highly important for the protection of the patient, but also the protection of the clinician. So as a function of ethics in our society, making agreements, as I just described to you, both the formal, the informal, but still documented, is very important. And as healthcare professionals and patients meet, they meet really in the very beginning as strangers from different backgrounds. They may be speaking very different languages. And I don't mean this language. I mean the contextual language, the understanding language. Therefore, coming to a unified agreement is very, very important in everything we do. But I'll say this again. With ketamine work, all our responsibilities, all of them, are still present, but they're heightened. We have to perhaps be even better at obtaining informed consent, perhaps even better at offering psychoeducation, perhaps be even better at every single element of the ethical world that we live in, because I can't think of a more scrutinized area of work I do, and I'm a psychiatrist, than the work I do with ketamine. So creating harmony, it's difficult sometimes, but it is crucial. And the harmonization is between the clinician, the patient, but sometimes it's between clinician, patient, and the support system. If there's an active support system, to have them understand what we're doing is crucial. But sometimes it's also the setting we work in. For example, I know of emergency room clinicians who are true believers in ketamine work, and they want to give ketamine to every patient who walks into their doors who has suicidality or chronic pain in an emergency room. However, the emergency room perhaps may not see the use of ketamine in that context as appropriate. And it would be inappropriate for the clinician to go against the wishes of the organization, because that's, the shortest way to end your career and to get into perhaps ethical trouble, perhaps disciplinary trouble. Now you see why this creation of harmony within a system, within a society, between patients and their clinicians is of crucial importance. And I'll lay out for you some items to consider. There are sometimes differences in power and self-esteem and communication and personality and attitude that can really create trouble with harmony. Education level can be very different. For example, the context I just used. The emergency room may be under the guidance of an internist. The disciplinary committee of the hospital may be under the guidance of an internist. Now, the emergency room itself may be run by emergency room doctors and nurse practitioners, etc., etc. But even though they all have similar education, they may have very dissimilar education about, say, non-ordinary states of consciousness. Therefore, being cognizant of that and giving that attention is, of course, important. Culture. In some cultures, for example, having a non-ordinary state of consciousness may potentially be seen as a challenging experience and to be avoided. It's possible. It's also possible that a patient may not really desire that, even though you think it's the best thing for them in the context of the disease they suffer. So again, harmonization is crucial with everything you and I will do as it relates to ketamine work. So how may harmony be achieved in our context? And I think if we just go back to the basics, think about the ethical principles and behaviors we just talked about. If we follow that, if we follow those particular rules, it actually is a beautiful roadmap to get into the process of harmonization. Which doesn't mean we will get exactly what we want, or it'll be exactly what we think is right, but it will be, if we go through the process of harmonization, the best that could be achieved in that particular context. So it serves to make it possible for us professionals to deal with each other at a human level with respect across all disciplines, helps us interact with our patients of all types in a manner that is best serving to their needs. And finally, I will remind you that to make it possible for professionals and clients to deal with each other at a human level, these ethical principles really make it possible. They make it possible no matter which environment we are in. It could be an outpatient practice, inpatient practice. It could be a naturopath's clinic. It could be a family practitioner's clinic. It could be an addiction clinic. It doesn't matter. These are basic human principles, and it makes it possible for strangers, and we are strangers when we meet our patients for the very first time. It is possible for us to achieve understanding, and if full agreement is not reached, at least tolerance for each other's beliefs is of the medical records. Let's put this all together before we leave this section, okay? So there's a wonderful model called the Husted's Formal Ethical Decision-Making Model, and I very much encourage you to please consider this as your North Star as you embark on this journey towards becoming a top-flight ketamine provider, which is to please remember the principles of autonomy, freedom, privacy, fidelity, beneficence, veracity must all be applied at all times when we work with our patients. Now, context, situation knowledge may alter some of the decision making, but almost none of us online today, connected today, are going to be using ketamine in a life or death emergency room situation. I think primarily our use will be in the context of the treatment of patients with specific psychiatric disorders, specific chronic pain disorders, or a combination thereof. In those situations, you and I have zero excuses, zero that I can think of, where we would not leverage the power of the ethical principles given to us by following the principles of autonomy, patient freedom, patient privacy, our responsibilities for full fidelity, beneficence, and honesty. Over-promising, sadly, has become part of the nomenclature of perhaps over-enthusiastic ketamine providers. I have no trouble with enthusiasm. In fact, I think enthusiasm is the missing catalyst of what we do in clinical practice, but over-enthusiasm, not based in logic, not based in data, but just wishful thinking or our own personal belief, based perhaps on our own psychedelic experiences, is not veracity. It can be construed by the world as overpromising and false advertising. And at the end of the day, it not only will harm you in terms of your relationship with future patients, it will harm the entire field. So if I make mistakes, you, no matter how many hundreds of miles you're sitting away from me, one way or another, you could also face the consequences of that. That's just the way it is, right? And the same is true if you don't follow these particular rules. And of course, context, situation, knowledge ultimately does help us get to the right decision. And sometimes the right decision is to not agree to do ketamine work. And that's okay. That's okay in the right context. There are situations where you would say no. Though, of course, in the majority of situations, when you follow these principles, your diagnostic process has been solid, the patient is appropriate, you have full trust in the patient has trust in you, all the stars have aligned, and of course,